Well, over the last few weeks, hospitals in Kettleland have been gearing up to fight COVID-19. And one of the ways they're doing so is by making sure that they have enough personal protective equipment. In tonight's Health Beat, Kettleland's Sophie Heineman is finding out how Sanford Health is keeping its staff protected.
Working in the medical field is something Kelly Wharton always wanted to do. But now, when the Sanford Health ER nurse arrives at work, she's suiting up in more than just her scrubs.
Gloves, a gown, the mask. We have actually 2 masks that we wear then, so the N95s and then just the regular surgical masks. So we wear those together. We wear a face shield, we wear eye gear.
Those are just some of the items helping keep patients and healthcare workers like Wharton safe, and she's thankful for the protection. Dr. Mike Wilde with Sanford Health says although other areas of the country are experiencing personal protective equipment shortages, Sanford is not.
We came into this doing really quite fine as an organization. We tend to prioritize things that we may need in a surge.
He says the hospital has taken various steps to conserve PPE, but also thanks people in the community for their efforts in helping slow the spread.
This is one we're all unified against, and so thank you, and continue like I continue, like we all need to continue, reminding each other of social distancing and hand hygiene. That is just so critical.
Wharton is happy with the work the hospital is doing to ensure PPE is available, because just the thought of running out worries her.
It would be scary. I think it's scary enough right now having everything that we do need, just because there's not a ton of information known about this virus in particular.
But right now, her passion to help others is outweighing fears of what if.
When we all signed up to be nurses, we did it because we wanted to help people, and that's what we're being called to do right now, because there's a lot of people that do need help.
With Health Beat, I'm Sophie Heineman.
The CDC recently changed its guidelines, stating that even those not working in healthcare should wear masks when out in the public. Wilde recommends people who don't work in the healthcare industry opt for fabric masks and donate any surgical masks that they may have to healthcare facilities.